Don again, continuing our video series. We had a question from Dean in regards to old man calves. So calf injuries are certainly something that can be a prevalent injury among runners, particularly distance runners. Some of that can be due to overload, and one of the first questions we would always have is whether the shoes are appropriate or not. If someone had shoes that were too cushioned and too soft and they had very flat pronating feet, generally speaking it's not a good combination. Secondarily, if they had very rigid supportive shoes and they had very rigid high arched feet, it's once again not a good combination. Either of those two combinations can lead to injuries. However, there's another few different things that we see quite commonly. There's been a prevalence over the last 5 to 10 years of people moving towards forefoot running or forefoot striking when they run. And there's pros and cons, and we're not going to argue about that specifically today. However, what I would say is if you're trying to work into forefoot running, if you do progress too quickly, there's a very good chance that you're going to overload your calves and get calf injuries as a result. So most injuries of tendons and muscles in the body are a load issue. People are pushing too much load too quickly, they're starting to run too many miles too quickly, and they're not giving the body time to adapt. So when we look at adaptation curves, muscle adapts relatively quickly. We can start increasing strength in 4 to 6 weeks from starting a new strength training program. The tendons and ligaments are a different story. They take substantially longer. So if you accelerate your training too quickly, then often you develop too much strength, then the other structures cannot deal with that increase in strength, and so people get injuries. As we age, our healing rates reduce or slow. So we're at a high risk of injury. So we need to be more mindful about the acceleration in our curve of training. And the other thing we need to think of is sometimes we can get some vascular insults or reductions in flow that mean the muscles are not getting the blood supply they require. Now in the calf particularly, popliteal vein, artery and muscle go behind the knee. For some people they'll get little strictures that will restrict blood flow in the popliteal artery, which means that the general blood flow into the lower leg, in the calf particularly, can be compromised. It can be a very common reason for calf injuries in middle-aged men. It's particularly notable if you've had previous injuries in the calf or tears that have got scar tissue formation. The scar tissue then is essentially entrapping that blood vessel that causes the reduction in flow that then lets them injure the calf more easily. We've seen a number of cases like this that have been misdiagnosed and mismanaged for a number of years. When you investigate and look at MR studies, you can see the restrictions. It's a bit of a complex one because generally it's a vascular surgeon required to open up that stricture, but it can be something that would be a causative factor in what someone would just call old man syndrome or old man calves, where they've actually got a previous injury that reduces blood flow. Second thing is if you've got scar tissue there, then maybe we want to break up that scar tissue so that the calf functions more normally again. So we'd use a range of different techniques to do that. Sometimes dry needle and acupuncture techniques, sometimes stretches, sometimes we would use essentially ART or muscle release techniques to improve the length and pliability of the muscles, but at the same time we'd always want to assess the foot biomechanics, the gait biomechanics, and ensure that the calf and the foot mechanics are being supported appropriately by the right footwear. So I hope that gives you a couple of tips and pointers you can think about, and hopefully that helps.